Well, traditional braces still most of the time can get most things corrected better than anything else can. It's just one of those ones because you got an attachment that attaches to the tooth, and you can put a decent amount of force on there with the different kind of wires. You can bend wires certain ways to do it. So you have a way of being able to move the tooth almost any direction you want to, whereas in some instances, like with Invisalign, it may not be able to do that movement yet, and they're probably still working on that. Most things have been taken care of, but the traditional braces, I guess you'd say there's two types. There's the ones that are traditional from 20 years ago, where they just had the four little wings and your wire would stay in there, and then they put the color on there to hold the wire in place. Nowadays they have self-ligating brackets as well. Same type thing, but it's like a little trap door that comes down and clamps down and holds your wire in place. Those are much more efficient, and they continue to work longer because you don't worry about those little elastic rubber bands kind of stretching a little bit and deforming, so all of a sudden your wire's not actually being held in all the way. So they work faster, a little more efficient, and usually cut your treatment time down also. So most of the time we treat people, if they're going to go with braces, we use the self-ligating, either the metal ones or the clear ones. They come in clear also. The main thing with the self-ligating brackets is the standpoint, since it's actually holding the wire in, so the wire's doing all the work for you. So if it gets the wire and it's holding in completely, then it's actually moving the tooth as far as it's supposed to and continues to work the whole time. So some of these people that, well, we've had cases where the parents are divorced and they're going to go stay with dad for the summer, so they're going to be gone for 3 months and they're all worried it's going to slow their treatment down. Well, if you put the right type wire in, you have these self-ligating brackets in, it's actually going to continue to work the whole 3 months, where in the past it'd be a thing where you're going to get about 4 to 6 weeks of good movement, then nothing's really going to happen until you come back. And so with these self-ligating and with the type wires that we're using, you can continue to work even though you're not able to make it in here as often.